Hi guys, Dr. Pelto here. I want to talk today about one of the conditions that you may have never heard of, but we see it quite frequently amongst our athletes and other types of patients. The technical term is called Freiberg's infarction, and it's called an avascular necrosis of one of the metatarsal heads. So let me explain a little bit about what this is. So if you look at this picture, you can see there are 5 different bones on the foot, the metatarsals, and there's one of them that has a little circle around it, and it looks a little bit more squared. It doesn't look as round, and this is called a Freiberg's infarction. And what this is, it's usually caused by repetitive trauma. And so, for example, if you're a runner and you like to be very active, if you have continued repetitive trauma on an area of the foot in the same area, it can cause the bone to lose the blood supply. That's the thought. And as it loses the blood supply, that bone collapses a little bit, and then it causes arthritis in that joint. It can be something that's quite problematic for many of our patients. And the initial treatments for this, if you're not sure of what's going on, you might try a cortisone injection, you might try a shoe insert or an orthotic. But if it's not getting better, you may have to consider some type of a surgical intervention that can be done for this problem. This influences patients on a daily basis if they have this, because they have swelling and pain to the front of the foot, and they might think they just have a simple stress fracture that's not getting better, and they wait and delay on getting treatment. So I think it's very important that you seek out treatment if you're having pain to the front of the foot, if you're having swelling, and it's going to eventually develop into a lump on the top and on the bottom of your foot that's going to be painful. Many people think if they have a stress fracture or foot pain in the front of the foot, there's nothing they can do about it. And for many times, that's the case. But in a condition like the Freiberg's infarction, or this thing where there's lack of circulation to that bone, it's really important that you see someone. So I would recommend you learning more about this condition, or even coming in and getting a simple x-ray. So I invite you to come to the office. If you want to make an appointment, I'll put some information underneath this video. If you have any other questions about this condition called Freiberg's infarction, please let me know.